The authors have no financial interest in any subject matter or material used in this film. In this video, we are going to show a case scenario where we have successfully managed a posterior capsular rent utilizing the fluid dynamics with dispersive viscoelastic and bimanual irrigation aspiration cannula. Friends, so here we are accosted with posterior capsular rent. How can we make a difference? Option 1, dry aspiration with Simcoe's cannula, followed by anterior vitrectomy to aspirate the residual cortical matter. Option 2, a usual bimanual aspiration or coaxial aspiration cannula to remove as much cortex as possible and then do a vitrectomy. Here we present a real life situation where one of our surgeons, while trying to remove cortex with a phaco probe, ended up with a capsular rent. As I noticed the rent, I asked the surgeon to just stop, remove the phaco probe, and put a visco-dispersive viscoelastic into the anterior chamber. As I was getting ready to manage this situation, there were a lot of options that were going on in my mind. First of all, I injected more visco-dispersive material into the anterior chamber. Now this material has a property to stick to the rent, thus partitioning the anterior chamber from the vitreous cavity. Then I lowered the bottle height and used the bimanual cannula. I made sure that the anterior chamber is well maintained throughout. I aspirated the initial air and now I start removing the cortex gently, starting farthest from the rent. Here I want to stress that I kept the irrigation cannula very close to the corneal port and aspirated the cortex with the aspiration cannula. The fluid dynamics are very critical throughout to prevent the fluid from entering the vitreous cavity. The fluid wave that is generated by the irrigation port is near the cornea and away from the posterior capsule. The cortex was slowly removed from one quadrant to the other and finally close to the rent. After the complete removal, I put some more visco-dispersive, and now you can see here that we can clearly see the rent. Look at the edges. The smooth rent margins show that the vitreous has not prolapsed out. I am checking whether there is any vitreous strand which is coming out of the rent. Once I was sure that there is no vitreous in the AC, I injected the intraocular lens in the back. The lens is then dialed and then I remove the residual viscoelastic with the coaxial method. Wow, we could complete the surgery in a short time, as if nothing had happened. We were thrilled and excited. Friends, now let us analyze the fluid dynamics that we used to manage this rent. This animation shows our option 1, that is the dry aspiration with Simcoe's cannula. As we do dry aspiration, the cortex is aspirated, there is no inflow. This creates a vacuum and negative pressure, leading to anterior chamber collapse. The cornea dips down, the posterior capsule comes up, and the vitreous rushes into the anterior chamber. Once the vitreous is mixed with the cortex, the story is totally different. The grave is dug. If we analyze our second option, that is the coaxial cannula, we need to remember that the irrigation port is close to the aspiration port. And if we analyze the fluid wave, it strikes with a force perpendicular to aspiration. In a coaxial cannula, once we are inside the anterior chamber, at the time of removal of cortex, the fluid wave strikes with force at the posterior capsule and into the vitreous cavity, leading to vitreous prolapse. This is more so when we tilt the cannula to remove the cortex and the fluid wave directly goes into the vitreous cavity. And yes, if the fluid goes into the vitreous cavity with a force, then the vitreous is certain to come out. When vitreous is mixed with cortex, we have to do nothing but a vitrectomy. Now, finally, what we did. Before we start to show what we did, let's look at the fluid generated by the bimanual irrigation and aspiration cannula. The fluid here is parallel to the corneal surface and the posterior capsule. This animation shows that the viscodispersive material first coats the rent, then the irrigation cannula is kept near the corneal port. The fluid waves generated by this irrigation cannula does not disturb the rent and the aspiration can be done gently. The anterior chamber is maintained at all times. There is no turbulence as the vacuum created by aspiration is replaced by the fluid coming from the irrigation port. There is no fluid wave that is directed to the posterior capsule or the vitreous cavity. So friends, we need to remember that in the anterior chamber, the irrigation port is on the top near the corneal surface and the rent is down. So we are able to aspirate the cortex without the fluid going into the vitreous cavity. In conclusion, the take-home message is that we need to be prepared when such an eventuality occurs. We need to keep the fundamental principles of using a viscodispersive material, the fluidics of bimanual aspiration cannula, and yes, we can make a difference and manage a PCR with so much of cortex without vitrectomy. And the patient had no clue what happened in his eyes. Thank you. This is a LAL 2020 Eye Care presentation.